Last week, RFK Jr. removed every member of a scientific committee that advises the CDC on how to use vaccines and plans to replace them with his own picks. What could go wrong? Something tells me our guest today might have some good insight. I am Maggie Gehlsen-Burnett.
And I'm Mallory Hagan. This is Pretty Furious.
What a week, what a week, what a week.
Gosh, so much chaos is happening that I think much of what we're talking about today is kind of getting swept under the rug because we have been very focused on the deployment of our National Guard and troops or threats thereof to California. That's kind of like taken over the news cycle. So much has happened over these last couple of weeks. So we're filming and recording on Tuesday, June 10th. So God knows what's gone on. We've definitely had the parade between when we recorded this and when it airs. So we'll have some commentary there. And if you're not following us online at Pretty Furious Pod, you should be, because that's where the daily commentary is certainly happening. We're over on Substack, YouTube, et cetera, et cetera. So be a part of our community. We'd love to have you. And of course, if you find value in anything that you hear today or otherwise, we would really appreciate a review. I think our guest today is one that's going to blow you away with her in-depth knowledge and ability to really articulate the intricacies of the healthcare and nutrition, MAHA, RFK, all of it. She is phenomenal.
I'm just blown away by her. But Mallory, you can't be pretty fair. I
think we just need to keep posting these.
Honestly, yeah.
I look like I'm death wormed up today. I don't know if it's this light.
I have a part that is over to my left ear, so like literally what?
Why do I look dead? I look swollen and dead.
You don't look dead.
I did start a new medication, so maybe that's it. Anyway.
But Mallory, you can't be pretty furious without being pretty first. What's your product today?
Maggie, I literally just got through saying that I don't feel very pretty. But I do have a product that'll make you feel nice if you don't feel pretty right now. Actually, this was a Mother's Day gift from my husband, along with my 3 balls, one for each boy. But he actually got me this fabulous, I love to take baths. I'm a nightly bath taker, bath soaker. I sit in the tub and I do my Duolingo and I catch up on TikTok. But anyway, this is Library of Flowers. They are a small batch perfumery, and he bought me a couple of these. This one happens to be Willow and Water, but they are so fragrant. They smell so good. And this packaging is just so cute for bubble bath.
Yeah, that's gorgeous.
So yeah, that's my product. I'm really loving trying out all these different ones that he got me for my nighttime bath routine, and I like it, so I share it. What about you?
What language are you doing on Duolingo?
Espanol.
Do you think it works?
Sí, señorita. Actually, I guess technically you're turning 30. Are you a senora?
Yeah, that's when you officially get bumped up into a different category.
Yeah, I'm on, let's see. I'm on...
Yeah, tell us what day you're on.
330.
Oh my God.
I know, I'm proud of me. I haven't done anything for 330 days ever in my life.
I really should try to get on that. I really had aspirations that I was going to learn Italian someday. So, I don't know. Anyway, so moving into my product. This product is the Medicube Collagen Night Wrapping Mask. This is what it looks like. Okay, so Medicube, they're one of my favorite Korean skincare brands. I love them.
Medicube is constantly being fed to me online. And I just thought, it can't be that great. I'm just being fed whatever the latest thing is. It's great.
It's absolutely that good. Yeah. So you put this on at night and you're going to look like a slithery snake. You will look wet. I'm not even kidding. I did this the other night and Ty was like, what is on your face? I was like, listen. But, okay, the craziest part about this is that in the morning you wake up and you peel it off of your face. And It is satisfying, and it's also very jarring. Ty saw me do it one time and was like, what is happening here? But once you peel it off, your skin looks so glowy. It's like tight. So I love this stuff, and it's pretty inexpensive. So yeah, that's my product.
Products make us happy. Headlines do not. What headline is making you pretty furious this week?
All right, so I've got one. This will probably be old news by the time this episode releases, but with the LA protests going on, I figured I would share something from that. So this one is from the New York Times. It says fake images and conspiracy theories swirl around LA protests. So this is talking about the disinformation that's being spread on social media platforms, some of it utilizing AI to create like fake videos, fake images surrounding the protests, which are, by the way, and have been basically this entire time incredibly peaceful protests. If you look at some of the content creators who are posting live streams from LA, they have been incredibly peaceful. I saw a video from a content creator I follow who posted a video of a protest where everybody was singing all together, and I think they were singing Stand By Me. So there are tons of videos going around out there. I would implore you to just check on what source is sharing the video and sharing the image. But yeah, really the only reason that these protests have now turned violent in really any capacity is because buddy old pal Trump has deployed all of these troops out to a problem that does not require any kind of military personnel, but will probably be his way of utilizing martial law in some capacity is kind of what the theory is on that. So yeah, just take a look at your sources, folks.
It goes into what we were talking about in our episode last week. This big, beautiful bill has the ability to, deregulate AI or not regulate it at all. And we could be seeing stuff like this over and over again. Okay, so my headline is the Trump EPA rollbacks would weaken rules projected to save billions of dollars and thousands of lives. This comes from the Associated Press. And essentially, this administration could prevent about 30,000 deaths annually and save $275 billion a year, mostly by limiting pollution from fossil fuels. So experts are saying that even a partial repeal would significantly increase harmful pollutants like smog and fine particles, leading to more respiratory illness, premature deaths, and climate-related health problems.
Imagine that. Imagine that.
Wonder what Jessica will say about that.
I know, exactly. Well, let's introduce Jessica.
Yeah, Dr. Jessica Knurick is a registered dietitian and nutrition scientist who breaks down complex research on nutrition, public health, and food policy. With a PhD and over a decade of experience, she's built a following of over 1 million by translating evidence into action and pushing back on misinformation. Let's welcome Jessica. Welcome in. We are so excited to have you here. You brought a headline for us that's made you pretty furious this past week. Can you read it for us?
Sure. Yeah. Thank you so much for having me. I suppose there's a lot to choose from, but that the White House health report that came out, so the Maha Commission report was released, and it included some great investigative journalists went through and found that it included 7 completely made up or hallucinated citations, meaning that AI helped to write the gold standard science report.
Doesn't that just give you so much faith in where we're at right now?
Yeah. And I think it's just really important to point out that this report was actually the first of a series of reports that's supposed to come out. This report was supposed to be looking at what are the causes of childhood chronic disease, and it's supposed to be being used to then define policy or dictate policy. And that policy-related report is supposed to come out in another 100 days. And so it's very clear from the fact that it had hallucinated citations, and within the citations there were lots of broken links, and there was at the end, when you pull like sources from AI, they'll have something called like OAI cite, which is like a demarcation that shows that it was pulled from AI. So several of the citations also contained that. So it's pretty concerning to someone who, if a student brought that to a professor at an undergraduate level science course, it would be an automatic failure. So not great coming out of HHS.
Yeah, not great coming from our country's leaders, right?
No.
Yeah,
You know,
exactly.
we are going to get into how you got here and how you've amassed the audience that you have. But one thing we talk about a lot here, and we touched on this particular headline a few weeks ago, but one thing we talk about a lot is just the overwhelming distrust in science, in people who have expertise in their field as a whole. Before we dive into you as a human, just what does that feel like to have gone through your education, spent time and money and energy to become an expert in your particular field, only to have people consistently saying that they've done their own research?
Yeah, it feels disheartening a bit, but I also do really try to kind of understand where people are coming from. And I will say that, like, I take some ownership, not me personally, but just my field and just science in general. We haven't always done a great job of being available to the public in terms of being able to kind of like talk about the science, right? Scientists in general really speak in a language that's not accessible for people. They write in a language that's not accessible for people. Our work is behind paywalls that people, you know, unless you have access and you're through a university or a research institution, you know, it could cost you $80 to get one research paper. People aren't going to pay that. And so I think, you know, in terms of science communication, we haven't really gone to the places where people are going to get their information, which is largely, for better or worse, social media. So we have great science communicators out there. For a lot of us, it's kind of been communicating through kind of public health agencies or through their websites, and no one's going to those to actually get kind of like scientific information. And so what we've kind of allowed to happen is the narrative to be dictated by people who aren't evidence-based practitioners, who aren't scientists in their own right, and who have kind of reasons to be on social media, like selling supplements and selling lots of, you know, BS things, selling $5,000 detox programs, those types of things. And so unfortunately, for a long time, and I can kind of get into this with a story, but, you know, it was frowned upon for experts to go on social media. And I think that was a really big issue for us for a really long time. And so we were late to the game and we kind of lost the narrative. And so I think it's on us to be able to be more available to the public and to actually be able to provide a thorough explanation for some of these things instead of just kind of like relying on their trust. Because as we can see, that trust can be really easily manipulated and kind of eroded with some of these bad actors.
Yeah, definitely. People have come to know you pretty well online, or at least know who you are. And I think when I started following you, Jessica, I think you had like 100,000 followers on Instagram, and now you just passed 1 million followers. What brought you into this space in the first place? Where did your passion for nutrition science come from? And how does it feel to have all of these eyes on you during this time?
Well, I guess my passion for nutrition science, so what brought me into the actual field so long ago was I'm a lifelong athlete. So I played a bunch of sports growing up, and I played college basketball. And so I think it was athletics that really brought me into it, because I was like, oh, I want to like fuel my body and I want to be, you know, as healthy as possible. My grandfather I was really close to, in my senior year of high school, it was in his early 60s, and he was snow blowing. We lived in Michigan, and he died of a heart attack. He had type 2 diabetes at the time. And I think I started to realize kind of how, you know, lifestyle factors can really affect a lot of these potentially like lifestyle related chronic diseases. And that's what really brought my research focus. So I kind of started out just thinking about like, how could we like fuel individuals for like athletics? But then what really kind of like, I was kind of thinking, well, what could help the most people? It's not going to be me ensuring that athletes are able to like run their fastest, right? Although that's a cool area. But so I started researching with my dissertation work, prevention of chronic disease. And so I looked at reducing risk of cardiometabolic disease, type 2 diabetes, cardiovascular disease, and what could we actually do to do that? And as I got into the research, I really started to see, you know, we actually had really good research about like what kind of dietary strategies and lifestyle strategies could reduce risk of disease. But what the problem was is that when you look at the behavior change research, it was very difficult to get people to adopt those behaviors. And so I started thinking, well, okay, what could we do? And this is what my dissertation work was what are like the minimum viable things that we could get people to do that would actually have a meaningful risk reduction for them? And so we used things like fiber supplementation and walking after a meal, just like a 15-minute walk. And we were like, maybe this will be more, we turned them easily adoptable strategies. And so that's really what brought me into this focus. But as you start to go through that research and you start to think kind of like systemically and holistically, you realize, okay, so we have all of these great recommendations. People aren't adopting them. Why aren't they adopting them? Is it a lack of willpower, or is it something bigger? Because we all make choices within systems. And when you look at chronic disease rates and things like that, life expectancy in the United States, that's not evenly distributed across the United States. And there's areas of the U.S. and there's demographics of the U.S. that are much more afflicted with chronic disease rates in this country. If you look at low-income populations, they have significantly higher rates of almost every chronic disease and much lower life expectancy than high-income individuals or high-income populations. And so that is what really brought me into this idea of like thinking about policy and thinking about systems and how the policies are impacting the systems and how the systems are impacting our health behaviors, and it's all really connected. So that was kind of my research trajectory. What brought me to social media was I had my son in 2019, and then I had my daughter in 2022. And in between that time, TikTok kind of became big. And so I just noticed this huge difference between when I had my son.
There was also a global pandemic.
There was also a global pandemic and everyone was sitting online. Yes, that's very true. So that was probably also a big thing. And so I just noticed, because when you're pregnant, you start getting fed with like all of this information because you're just a really like vulnerable
Mallory's
group
pregnant
of people.
right now.
Are
So,
you? Yeah, so you know. So your algorithm starts to change.
Can we talk about how every video that I open is about how it's okay to co-sleep with your baby? Every single one. Anyway.
Yeah.
I'm like, what is going on here?
Yeah, and you know, it's a real. I mean, and you know, companies know this. Like, you're sitting there online all the time. You're trying. It's a period of time, by the way, when you're like you have to learn so much information. You're like, what's happening to me? Like, what? I'm gonna have to like keep a human alive. I need to learn all this new information, and so there's plenty of information out there, right? Whether it's correct or not correct. So I started seeing all of this inaccurate information, particularly around pregnancy and nutrition. And I was just like, this isn't right. And because I was in that life stage, I just felt kind of protective over the women also in that life stage. And so that's what brought me to social media. It was in 2022. I just started going on to correct some of that misinformation, some of the stuff around like foods to avoid and, you know, the glucola test, because I ran tons of oral glucose tolerance tests in the lab throughout my research on diabetes. And so that's what I did initially. And then I would say I did that for maybe a couple of years. And then as this MAHA movement started, which was in the summer of last year, was really when that started kind of like taking shape. I just started noticing, because that was my exact area of research, it was very easy for me to identify all of the manipulation and the misinformation coming out of that movement. And so I just kind of felt this obligation to change the course of direction of my content and just start talking more about like what was going on with kind of public health and how they were manipulating the narrative. And so that's what I did. You know, I would say that one of the benefits of this, there's a lot of cons that I'm sure we're going to go over, but one of the benefits is I think that people who have never been interested in this, never been interested in public health, never been interested in how policy is impacting our food environment and our health, are interested, and I think that's reflective of kind of the growth of my account over the last year, I'd say.
Yeah, I know for sure that I time and time again have turned to your content to better understand something. So just first of all, thank you for taking the time and energy, because both of us make content on our much smaller scales, and it's time consuming, and it's draining, and reading through insane comments, even if you're a logical person who knows maybe it doesn't have a whole lot of merit. I mean, all of those things take time out of your day and out of your week. And especially when you have young kids, we just thank you for making sure
for your service.
That information is out. I actually kind of want to go back a little bit, because I was noticing as we were researching you and just watching a little bit more content, listening to you online, that I don't really have a good sense of like how you grew up. Where did you come from? What was your family dynamic like? What were your meals like at home? How did that look in maybe the way that you grew up and how that translates to how you live now?
Yeah, I grew up in Michigan, in kind of like a small, I would say like maybe a mid-sized town, maybe like 40,000 people. But But what I didn't realize at the time is like I'll bring people back there now, including my husband, and he's like, "Wow, you really grew up in like farmland," because I did. I grew up like right next to a farm, and I didn't really, and like 20 minutes away from like an interstate. So it definitely like was off the beaten path a bit. But I have a brother and a sister, a younger brother and sister, and my parents. I'm a first generation college student, so my dad was a furniture salesman, my mom was a stay-at-home mom, and then was like a teacher at a Montessori school when I was a little older. I grew up kind of like, I'd say like a middle class, kind of just your typical family. And in terms of, I mean, I grew up in the 90s. Like I was a kid in the 90s and early 2000s. And,
wait, were you also making sugar cinnamon toast in the mornings by yourself?
I sure
Latchkey
was.
style?
Yeah, of course.
Our kids today don't know anything about that. I'm like, go get a piece of toast, put some butter and sugar and cinnamon.
My sister and I were just talking about this because I don't know. Did you guys see their trend? I mean, I don't know if it's a trend, but it's been on. This is what I learned about it on like TikTok was ingredient only households versus like households that would buy snacks. So I came from an ingredient only household. Like we didn't.
Yeah,
my parents were
same.
pretty frugal, and they weren't gonna like buy like snacks unless it was like a special occasion, Christmas or something. So like we'd make our own snacks. So I would take tortilla chips and put like shredded cheese on them, and that would be nachos. Or I would take like apples and cut them up and then put sugar and cinnamon on them and put it in the microwave, and that would be my dessert snack. So that's kind of like how we grew up. My parents, we didn't buy like soda in the house, but once I got to middle school, we could walk to like Burger King, and we would do that all the time. So yeah, I grew up, my dad would make us lunches most of the time, and he would always make this like turkey sandwich, and my sister would always trade it for money so that she could buy the school lunch. Yeah, but I would eat his turkey sandwiches.
I'm pretty sure our boys do that. I'm pretty sure they trade their lunches for school lunch.
Yeah.
Well, so then it's interesting to learn you grew up so far from an interstate or in quote unquote farmland. I live in Alabama. Maggie actually went to college in Alabama, and
But I grew up in Iowa, so I grew up super similar to you, Jessica. I was like, farm town, small town in eastern Iowa, 5,000 people, 20 minutes from an interstate, that type of thing. So yeah, I grew up very
I
similarly.
mean, mine was bigger, so there were like 40,000. I just looked this up the other day, so it's so funny I know the number. I was like, how many people lived in my town growing up? So it was like 40,000. But I do remember vividly when they were building a CVS on the corner by my house, and we were so excited for the CVS to be there.
Deal, yeah.
Yeah, because there wasn't really a store close.
yeah, well, that actually is what I was going to ask. Is it kind of when you grow up like that, and you start to look into the systems in place that keep people in positions of chronic disease or living unhealthy lifestyles. I think about all the towns in Alabama where people's option to shop is a Dollar General or the gas station, potentially Walmart, if they're close enough to one. And so when you think about like how those systems impact all of us, what comes to mind as the greatest challenge in order to encourage people to adopt some of those healthier habits or things that allow them to live a healthier lifestyle?
Yeah, I think it's a great question. So, and it gets to the heart of what public health is about. So public health, and I think there's kind of this like misconception about what public health is versus maybe wellness. And sometimes they're pitted against each other. And maybe even from me, if you see some of my content without maybe the context of all of it, you might think that I'm doing that. But I mean, wellness can be like really amazing, right? Like I have a pretty aggressive like wellness routine myself. Like I work out most days a week. I'm outside. I think it's important to get outside. I think it's important to like eat nutrient dense foods as often as possible, right? Like those are all like wellness things. They don't have to be like a $70 colostrum supplement or something like that. But that's different than public health. So public health really, what it means is to look at the populations in the country that are struggling the most and figure out ways to be able to help them meet their basic needs, right? Help them get access to healthcare, help them get access to food, help them get access to clean drinking water, things like that, ensuring that we all kind of have this baseline level of health. And that's kind of like what the most important aspects of public health are. And obviously helping everybody in the country have access to those things. But if there are people who don't have access to those things, how can we get them access to those things? And so when you talk about food, 13.5% of this country live in food insecure households, including 1 in 5 children. And what that means is that they don't always have access to the nutrients that they need to meet their nutrient needs. And a lot of those people live in what we term as what we call food deserts. And a food food desert, a lot of times that term kind of brings up this idea of like rural America, and that's true. There are a lot of food deserts in rural America. If you've ever kind of like driven through from like one coast to the other coast, you'll see like towns and there's not a grocery store within like miles, and you're like, where do these people buy their groceries? And so that's certainly true. A lot of those people are living in food deserts. The most of the food deserts in this country, though, actually are in urban areas. So places you might not realize are food deserts, things like Washington, D.C. or Chicago. They have, and this a better term for this is actually more like food apartheid, because it's kind of been an intentional thing, and maybe not intentional, but a consequence of policies that we've enacted, and policies that have made it so that grocery chains, because in this country, for better, I mean, for mostly worse, no, there's good and bad, but we live in a capitalist economy that really prioritizes corporate profits and growth above all other values, right? And so when you have corporations kind of prioritizing profits, they're going to go where the money is, and the money is mostly in affluent areas, right? So that's why, like, if you live in an affluent suburb, you have like 3-4 grocery stores you can choose from within like a 5-mile radius often. But a lot of these,
I have 3 Publix in 3 different directions, all within a mile.
Right. And that's not that uncommon in like affluent areas in the country. But you go into areas that aren't so affluent and grocery stores don't want to open there. And so what they've done is they've kind of left that area. And so as you kind of brought up, a lot of those people rely on, because they don't have good public transportation, and they don't have a good way to get to these stores. And so they rely on things like gas stations or dollar stores, and in order to get their groceries. And some of these gas stations, they'll have like a single table of produce, right? That like doesn't really look that good, and it's very expensive because the demand isn't there. And so it actually produces more in some of these areas. And so because of that, they're going to choose cheaper, more processed, more packaged items. And so those are what we talk about when we think about like the systemic barriers. Like if we are looking at the United States and we're saying, okay, over 90% of Americans aren't meeting vegetable and fiber intake guidelines. Why is that? What are some of the things that we can do? Obviously, some of it is we need to educate, right? So some of it is like, let's start young and start these education programs in schools. That would be a really good option. But other than that, we need to have accessibility, right? So if we're looking at like SNAP, which is the Supplemental Nutrition Assistance Program, and we want people to make healthier purchases on SNAP, what we've done is we've tried to incentivize healthier purchases by using things like Double Up Bucks. And that's a program that's in a lot of states where if you're purchasing fruits and vegetables using your SNAP dollars, you're getting double the amount for your money. And so that's like an incentive program for that. But also you have to have accessibility for these people. And so some of those things have been like, they've done like mobile grocery carts, right? Mobile like farmers markets, and they go into these areas and people can purchase. You can do things like grants and giving grocery stores incentives to open in these areas. But that all takes like intentional effort, and we haven't seen it. We haven't seen enough of it, and enough of a focus to try to improve kind of these systemic issues.
How do you believe, as an educator in this space and as somebody who has studied this for much of your life, how RFK Jr. was so able to kind of co-opt this like wellness movement and basically make it so that we were blaming all of the wrong parties and things for the issue of the health of Americans.
He tapped into something that I think many of us in a bipartisan way are concerned about. We're concerned about our food environment. Right now, our food environment, by some estimates, is nearly 70% ultra-processed food, right? And so we tapped into this idea that Americans do have these chronic diseases, these chronic health conditions. And there is some truth to the fact that those are increasing a bit, right? He actually overplays that. And this is kind of like a propaganda technique, but he constantly is making up statistics and making it seem worse than it actually is. He'll say things like 1 in 3 children have diabetes when it's actually less than 1% of children have diabetes, right? And just like those little things that because you already want to believe it and because you already think there's a problem, you just believe that it's 1 in 3 children without kind of like even assessing the claim or fact checking the claim. And so he has kind of like overstated the problem. But, this is why I started this research 15 years ago. There's clearly something to it, right? There's clearly reasons that, or things that we could be doing to decrease some of these lifestyle related chronic disease issues that we're suffering from, or many Americans are suffering from. And so he tapped into that. I've said before that he gets the vibes right, but he gets the causes and the solutions really wrong. He misses the mark on the causes and the solutions. His causes are very conspiratorial, very anti-science, very let's erode trust in science and scientific institutions and regulatory agencies, and then, solve that by putting in kind of ideological people that are aligned with him instead of what the actual causes are.
Yeah. As a quick follow-up to that, so you just touched on a point that I think is fascinating, and I think has been single-handedly the most interesting part of all of this to observe, which is that he has eroded people's trust even further in sort of these, quote, institutions, or like, quote, the system. The system is a term a lot of people, I think wellness influencers like to use. I'm curious from your perspective how you think that the system actually supports people. And by the system, I mean the governmental agencies that are meant to support and help people with their health, the CDC, the DHS, like I'm just curious to know from your perspective, how those institutions actually do help Americans.
I think one of the issues with public health is that when it's working, you don't know it's working. Right. And so it kind of operates without a lot of fanfare. So you don't really think about the, disease outbreaks that never happened, or the food outbreaks, the foodborne illness outbreaks that never happened. You never think about the clean drinking water that you just readily have access to every day. Right. And so that is kind of a PR problem for public health, because that is exactly what it does, right? So we have HHS is Health and Human Services. It's arguably the most powerful public health institution in the world.
I think I said DHS. I meant HHS.
Yeah,
HHS. Sorry.
Well, it's DHHS. It's the Department of Health and Human Services. So you were pretty much there.
Yeah.
And so housed within HHS are many agencies. Probably some of the more well-known ones are the FDA, the Food and Drug Administration, which ensures that all of the food, most of the food, about 80% of the food and the drugs, the pharmaceutical drugs in the United States are safe. And they do that in a variety of ways. So there's kind of like the food side of it, and then there's the pharmaceutical side of it, or the drug side of it. And the food side of it is they really ensure that, foodborne illness doesn't spread. They issue recalls so that like we can be aware of if there is even an issue. And that's a little bit misunderstood too. Recalls don't necessarily mean that the product is contaminated. It just means that potentially it's contaminated. So this is often, not always, but most of the time it's like, there's a potential. So we're going to recall this just in an abundance of caution. So that's what they do. CDC is the Center for Disease Control and Prevention. So they really are looking at infectious disease, and they're looking at globally. They're making sure that, those things aren't coming here, or that we are able to stop them, stop transmission. They're looking at kind of like vaccine safety and issuing kind of like recommendations for vaccines. At least they were, until RFK Jr. just fired all 17 people on ACIP yesterday, and or at least we found out yesterday. And then let's see, FDA, CDC, and then, Yeah, and so basically these agencies are responsible for kind of public health. The NIH is also housed under HHS, which is the leading premier research institution for biomedical research in the world. And so essentially they are conducting research in biomedical sciences and kind of like groundbreaking leading research. I think there's a little bit of misunderstanding about scientific research too. So there's really like three types of research, and one is government funding, and that pretty much comes from the NIH. There's some from like NSF and other places, but the NIH is a big one. And then there is industry-funded research, and that's for things that are usually going to be profitable for industry. That's what they're going to kind of fund. So vaccines are a big one, right? Or pharmaceuticals are a big one. So the pharmaceutical industry puts a lot of money into researching pharmaceutical medications, right? And if they weren't, we as taxpayers would be putting money into kind of funding research that then pharmaceutical companies were going to be making a lot of money off of, right? So it's good that they put money into the research for their own products. But the government research is really important for like basic science. So essentially like things that aren't flashy, and a lot of the like industry science, it comes from kind of this basic science. Like if you look at a lot of like Elon Musk stuff, Starlink and those types of things, that comes off of years and years of, or SpaceX too, years and years of government funded research in order to get to a point where it can be profitable for industry. And they also fund things that maybe are diseases that affect a small minority of the population. That's not going to be super profitable, but we still want like that funding. Women are usually in that category, which they're not really a small percentage of the population, but a lot of women funded research.
But our healthcare research has been deemed as such.
It's awful. Yeah. It's very poor. But yeah, so that's essentially like what HHS is. And they really it's public health infrastructure. It's how we keep, for all of the fanfare, for all of the like talk about how our food and how toxic everything here is, which we can get into how accurate that is. It's not very accurate. We're ranked at the top of most lists in terms of the safety and quality of our food and drug supply. And that all comes from Health and Human Services.
The thing you often hear from people, and I have said this, I've traveled abroad many times, the food is just cleaner. and I guess cleaner may not be the right word, but it contains less preservatives. When you can go to Italy and eat nothing but pasta, pizza, and bread for 10 days and lose weight, you're like, okay, something is awry here. So I think one thing that we all agree on, and you kind of touched on this, that this is a bipartisan issue, that we do want more care and concern when it comes to the preservatives that are in our food or the dyes that are in our food and how those things might impact us in the short and long term. But we're disagreeing right now on the policy and the ways to get from point A to point B, that we do need some sort of regulation. And it seems as though RFK and this administration are really combing back our access to information and regulation so that we know less and we have less, I guess, consequences or actions for companies and manufacturers and people who are producing our food. What do you think about our push to deregulate some of these things in the healthcare space?
Yeah, so I would like to talk about the nuance there with what you're saying in terms of like the difference between Europe and here. My husband's from Romania and we travel back there most summers. And so I've spent a lot of time kind of in a lot of different countries in Europe. And you're absolutely right. And so this is a situation where they take some truth and then they weave a conspiratorial narrative about that truth and don't even acknowledge the actual reasons that occurs. So for example, when you go to Europe, the food is just the food environment is completely different. And obviously all European countries are a bit different. So if you look at the UK, they actually have quite a bit of ultra processed foods. So their diet is comprised of quite a bit of ultra processed foods. If you look at Romania, where my husband is from, they're at kind of the bottom of that list. They are eating predominantly not ultra processed foods. They're eating a lot of home cooked meals and those types of things. And so there's definitely like variability in Europe itself, but for the most part, they have, access to what we term farmers markets. They have these like street markets everywhere. And here, our farmers markets are way more expensive than if you just go to the grocery store. That's just not the case there, right? So these markets, it makes fruits and vegetables very accessible for people. And the cost is not that high. Their ultra processed food is a bit higher, more expensive than ours, right? Because we in this country, we subsidize the main ingredients, corn, wheat, and soy, our commodity crops in our ultra processed foods. And so we artificially make those cheaper in the United States. And so the food environment in general is just so different over there. And so I think that's an important distinction. Also, when you think go ahead.
Do you think, sorry to interrupt you, do you think that any piece of that is societal, like social? In the US, we go to big box stores like Costco or Sam's Club and we buy a lot of something at once and we cook on it for 2 weeks. Whereas a lot of European countries, and I lived in New York for a long time, this was more socially the way that you did things there. Is like you go to the store once every 2 days and you buy what you need for the next day or 2 days. So do you think some of it is that as well? Just the way we operate as a society differently in the way that we buy products?
Yeah, so that's actually exactly what I was about to say. So yes, I agree with you.
Sorry.
So I think we need to look at we've all seen the video of people, right, like holding up Fruit Loops and holding up the one here and the one in whatever European country it is or Canada. And their rationale for that is that the United States is allowing these ingredients in our food from a regulatory perspective, right? And so they're allowing these toxic, quote unquote, that's in air quotes, ingredients in our food, and these other countries aren't. And that's where the little bit of truth is there, and then they weave this conspiratorial narrative. So let's take artificial food dyes. There's 9 artificial food dyes that are approved in the United States. There's far more approved in the EU. But out of those 9, there's only 5 that are really routinely used in our food supply, and that's red 40, yellow 5, yellow 6, blue 1, and blue 2. Those 5 are the ones you're going to see pretty much in all of your ultra processed packaged food. Now, those 5 food dyes, despite what a lot of people on social media will tell you, are all deemed safe and approved for use in regulatory authorities all around the world. So in the EU, EFSA has deemed them safe and approved them for use. In Australia and New Zealand, all 5 are deemed safe and approved for use. In Canada, all 5 are deemed safe and approved for use. So it's not a scientific regulatory thing, right? When I, as somebody who knows this information, seeing them say that like America is allowing these things in our food supply where these other countries aren't, I just have to call that out because that's not accurate. Like, go to any of these regulatory agencies, you can see the science they used, you can see the safety data, you can see their approvals. They're all approved for use. There are differences in the use. We use them far more here, but obviously that's not a regulatory thing, right? So our FDA approves them for use, EFSA approves them for use, Health Canada approves them for use. The difference is that corporations do not care about your health. For the most part, they care about profits and they care about growth. And so they're going to make what people buy. And in the United States, we tend to buy, many of us want to see bright colored ultra processed food, right? And that's a cultural thing. Again, I grew up in the 90s. I remember like the cartoons of like the little characters. And this is also, by the way, a policy decision. Like we're not regulating these corporations. So they're allowed kind of unlimited marketing to children and to low income populations. And they have these like fun little characters and they have these bright like rainbow cereals, right? And those are what sell. You know, if you look at back in 2015, General Mills, they tried, because they thought consumer demand was there for these natural colors, they tried to get rid of and remove artificial dyes from their cereals, from Trix and Lucky Charms. And they after 2 years, they got a ton of feedback that said that, you know, the cereal looked off and it looked dull. And so they added artificial dyes back in 2 years later. And so they're just like kind of, you know, they are doing what is demanded here. And so we need to change that if we want to. And I also feel like what gets lost in this conversation is if you want to choose and you have the means to choose a different option, those options exist here. It's like we act like they don't exist. But like you can go to my King Soopers right now. I'm in Denver, so that's Kroger here. And you can choose either Lucky Charms, or not Lucky Charms, Fruit Loops, or you can choose Fruitful O's. And Fruitful O's is like the naturally dyed version, right? And they're the same price too. I did like a comparison. Actually, Fruitful O's was a little bit cheaper, and they had the natural dyed. And you know, if Fruit Loop sees that Fruitful O's is taking some of their market share, they're going to change their dye color, right? And so again, they're responding to the market. And so it's not a regulatory thing. It's not a conspiracy. It's just the market kind of doing what the market does, because we keep voting for kind of a deregulated market. And to get to your deregulation kind of question, you know, this administration is deregulating many of these corporations. They came in and they have a 10 out, 1 in deregulatory agenda, which means for every new regulation put in place, 10 existing regulations have to be removed. And that includes everything. That includes the environment. That includes our food supply. And so when this administration is saying that they're going to come in and now regulate the food industry, it just doesn't match up with what their actual policies are showing. And so it's very interesting. It's like, okay, you're going to deregulate everything else, the environment, all of these other corporations, but you're going to regulate the food industry. I mean, it hasn't happened yet.
No. Well, it also, I mean, it sounds like this is much more a need of education and changing societal expectations or desires, which is marketing and PR and all. That's a huge process, right? And maybe even a pretty time consuming one, depending on who we're talking to or about. So I find that really fascinating.
Well,
that
and
it's actually more to do with what we're buying than what's regulated or allowed.
Yeah, and there have been strategies before.
Right.
I don't know if you guys remember the Obama administration, but that was what Michelle.
Yes.
That was Michelle Obama's entire platform, and she got just crucified for it. I mean, people went after her, said that she was, the Republicans were very much about her being a nanny and this being a nanny state and it being government overreach to tell people what to eat. I mean, there's just clip after clip during that era where you can pull from people just like, not being on board with trying to make these changes, these kind of evidence-based changes to change consumer behavior and demand. But yeah, that would be the ideal. So if you think about it from a systemic policy perspective, how can we change our food environment? It starts with agriculture. It starts with what we're incentivizing, what we are subsidizing. So right now we subsidize corn, wheat, and soy. And why do we do that? We don't do that for people's health. We do that because that is a really good export for us and it makes us more money, right? It's all about money. So we make the most money by having monocultures, by having these farms that produce one crop, right? They produce corn, whereas instead of a diversified farm that has a lot of different types of crops, which we kind of decimated. And I mean, that's a whole history in the 70s and 80s when that happened. We had the farm crisis of the 70s and 80s, and it kind of decimated local food systems. And that led to kind of this heavy reliance on these kind of packaged foods that could travel far. And so if we want to be less heavily reliant on these prepackaged foods that can travel far and be shelf stable and include all of these preservatives and additives that allow them to do that, we have to bring back more kind of like local food systems. And we have to invest in that. We have to invest in farmers and kind of give smaller farmers kind of grants or allocations that help them to transition out of what they're doing now and invest in new equipment. And so if you want to see a food supply change, it starts with agriculture and agricultural policy. And I did a video on this, and I think I also wrote a Substack article, but right now what we're seeing come out of our agricultural budget that's in the reconciliation bill and what's being proposed is the exact opposite of that. It's reinforcing our current agricultural system of really producing these commodity crops and not incentivizing and not looking after small farmers and small local farmers. And they are, they're cutting funding. They're cutting billions of dollars in funding from programs that helped local farmers to get fresh fruits and vegetables to schools and to food banks. They cut the Patrick Leahy Farm to School program, which was helping schools get like community gardens and learn about education. And so, there's a lot of talk in this particular administration right now about things that they want to do to improve the food supply, but the policies that they're enacting are the exact opposite of what we need in order to improve the food supply. And so that's what I really think is important, is to focus on what they're doing, right? Focus on the policies that they're enacting. And that's why I'm really passionate about helping people understand kind of how policy connects to our food supply. If we are all pissed off about our food supply, which I think we are, then let's make sure that we're not being misled about the reasons for that food supply. It's not because of scientists and our regulatory agencies. It's because of what we as a government have chosen to incentivize in terms of our agriculture and what we have allowed to happen with corporate profits and corporations to kind of dictate policy, corporations to be able to pour unlimited dollars into political campaigns to basically capture politicians so that they enact laws that are beneficial to them, right? And they can do antitrust laws and mergers and acquisitions, not allowing mergers and acquisitions where they shouldn't be allowing those things to happen. So now very few corporations kind of control our entire food supply. So all of those things are very connected.
Yeah. One thing I think about a lot with the sort of Maha Mommy movement is how a lot of them will say things like, well, we should be more like insert Nordic country here. We should be more like Denmark. We should be more like Sweden. And without kind of understanding, or at least possessing a cognitive dissonance that allows them to do this, where they don't understand that the social programs are a big reason why those countries are so healthy, and having universal health care and having access to healthy foods and transportation and doctors and all of those things that in America have been privatized and now people don't have the means to afford them. And so,
or even third spaces,
Yeah.
walkable
Exactly,
cities,
yes, walkable
spaces
cities,
where
yeah,
you have
exactly.
access. Yeah.
right. So I'd love to know your rebuttal to somebody who says like, well, I voted for Trump because RFK Jr., et cetera, whatever, fill in the blank about why they love him. And I want to see our country become truly healthier, like Norway or Sweden or whichever country you want to insert there. I'd love to know kind of how you reply to somebody who is really embedded in that thinking.
Yeah, I mean, well, I think you kind of hit on it with what you're talking about. We term them the social determinants of health in public health, and those are basically non-medical factors that directly influence your health. Things like economic stability, social and community spaces and context, and programs. Right. So we're one of the only countries in the world, that definitely the only industrialized country in the world that doesn't offer a paid family leave. Right, at a federal level, we're the only industrialized country in the world that doesn't offer universal health care and give everybody a basic health care right. Neighborhoods in the built environment. Our country was really built for automobiles. I come from Detroit. Everyone I knew worked in the automobile industry. And when I say that, like literally every friend I had, at least one parent was working in the automobile industry growing up. And so, our country was really built for cars. That was the whole point of it. And so we don't have good public transportation infrastructure in this country. You go to Europe, they have wonderful public transportation infrastructure. They have sidewalks and walkable and bikeable cities and towns. And we just don't have that on a mass level. Where I live, it's like it's a suburb of Denver, and there's sidewalks everywhere, and it's great because people use them. If you build them, people will use them, but we don't really have people building them. So we lack infrastructure. We lack healthcare access. Again, we're the only industrialized country that doesn't have universal healthcare. If you give people basic healthcare, and we have been kind of like trained, and it's been ingrained in us that these are handouts, or it's like a radical idea to be like funding these types of social programs where there's certainly like a moral argument to be made, but there's an economic argument to be made too for something like healthcare access for everyone, right? I mean, if you look at the cost of our healthcare in this country, and this is like one of the ways that they also cite this, that we pay like 2 times as much in healthcare, but we have worse outcomes. And I'm always so confused why Maha is citing that, because I'm like, yes, that's true. Do you know why that is?
And that's part of the problem.
Yeah, and I just want them to like follow that thought to its logical conclusion. And the reason is obviously, why are we paying so much in healthcare? Well, we have these healthcare corporations just making massive amounts of money. These CEOs making massive amounts of money, right? Because a lot of these are privatized healthcare. And so if you look at a situation where people don't have access to healthcare, what they do is they just put off preventive healthcare, right? And so what happens is we think that we're not giving healthcare to everyone, but we are giving healthcare to everyone. Hospitals are legally required, if somebody shows up at their door and they are having some sort of health condition that puts their life at risk, they have to see them, right? And so those costs get passed on to us as taxpayers. So it's not that people aren't getting healthcare, it's that they're just getting it when it's far more expensive. They're going to emergency rooms. What gets passed down to us is emergency room wait times that are very, very high, that don't need to be that high, right? Because people are using the emergency room as their primary care physician because they don't have health insurance. And even if they do have health insurance, perhaps their deductible is so high that they can't actually afford to go to those visits. And so they wait until it's a much more expensive case, right? So there's an argument to be made that if you give everyone basic health care, it actually will reduce costs and it will reduce healthcare needs. And that's kind of a situation of just kind of like, and again, ensuring everybody kind of has these basic access to their basic needs: food, shelter, healthcare access, education, right? Education access and quality. And this is something that's just like standard in many of these countries that are used when comparing us to other countries in terms of our healthcare outcomes. And they directly impact our health. It's not just about the type of food you're eating and the exercise that you're doing. It's also these social determinants that are so, so important that we in America have kind of been trained to see as like, again, like handouts or not necessary, or you have to earn it, right? It's like something that you like, if you don't have it, like pick yourself up by your bootstraps and like get access to healthcare, whatever it is. And I think there's just kind of this misunderstanding of what these programs actually are there for and the benefits of them. If you can get somebody, we see this with the Supplemental Nutrition Assistance Program, which is giving people access to food, and it helps 42 million Americans in this country. So many Americans rely on this nutrition assistance. And 40% of SNAP recipients, it's their entire grocery budget for the entire month. So it's not supplemental for them. That's all that they have for groceries at the end of the month. But when you do that, it's actually a very effective anti-poverty campaign, because when you can help somebody with their groceries, it allows them to pay off their bills or pay for their other needs that they have, right? And it helps get them on their feet, and then they can become contributing members. Well, not that they're not contributing members, but they can be in a better place to contribute to society. And so I think we kind of need a reframe of how we look at these programs. If we really want to be on par with some of these other countries in terms of their health outcomes, it's a lot more than just kind of like yelling at people about toxins.
Yeah, we actually, in the episode that we just released this past week, we talked about how both Maggie and I were children who were recipients of government programs in some capacity or another, and that people would never look at the two of us and say you weren't a worthy investment.
Yeah.
Right? That we have to reframe these programs as investments, not only in our society, but also in our economy.
Yeah.
When you have people who are fed, they get a better education. When they have a better education, they go on to higher education. I don't even want to use the contributing members of society, but they go on to have better careers. Yeah, but they end up with better careers, better outcomes, better ability to manage their finances. Like all of these things are so intertwined, and being able to help other folks see people who need our assistance or need these baseline levels of these health determinants, that's an investment.
Yeah.
It's not a handout. It's an investment in our communities and the people who are around us.
Yeah. And it's an economic investment as well as a health investment, because a health investment is an economic investment. So for people who need the economic argument, there is one to be made.
Exactly. How do you think that this MAHA movement will eventually impact sort of the next generation of children?
Yeah, I'm a little bit, I'm very concerned about it because, I already see it happening because I get DMs from people all the time in terms of like the fear that people have around our food. They're like, I don't know what to eat. Because a big part of this MAHA movement is predicated on this idea of toxins in our food, right? And how our food is poisoning us. And that's the reason for a lot of the chronic disease in this country. And we haven't even gotten into that, but there's just not evidence to show that. If you look at dietary eating patterns of people in this country, there's really strong evidence for why our diets are potentially part of the cause in some of these diseases, right? In some of these chronic diseases, we're over-consuming. 70% of us are over-consuming ultra-processed food, or over-consuming calories, eating too many calories for our needs. 70% of our food environment are these ultra-processed foods, and we're over-consuming them, right? So it's kind of like this idea of moderation. Well, if you're over-consuming anything, it's going to be problematic, right? And so it doesn't necessarily, like, for example, sugar. Sugar is a fuel for our cells, right? It's incredibly important for us. It's certainly, I'm a big advocate of like fruits and things like that, which are full of sugar. Sugar is not the issue. It's the overconsumption of sugar. And these ultra-processed foods make it easier for us to overconsume them, right? Because they have a lot of salt, sugar, and fat, which if you have 2 out of 3 of those, it makes something hyper palatable and easier to overconsume. And so Kevin Hall's work at the NIH has done a lot of good work with that and kind of showing that. But aside from that, it's this idea that, okay, so it's not, the evidence just doesn't kind of back up that it's the toxins in our food, but now we have this narrative, and that really plays very well for like Instagram and TikTok algorithms. Conspiratorial, fear-based information, kind of what we started this talking about, is really great for social media and people who are spreading that information. And MAHA really, what they did was they looked at what's been happening online for the last decade plus, and who are some of these really big influencers are and how they gained their following. And it really has been fear-mongering individual ingredients. And they used that exact same strategy in order to garner all of this support, because they saw it working. And so now you have kind of many people who are just terrified of the food that we have, and they're passing that on to their kids. And you know, I think we're going to see a lot of issues. I mean, as dietitians, we're really trained to identify, to work with, you know, like eating disorders, even like orthorexia, and kind of looking at these orthorexic eating behaviors. And I see it all the time in my DMs with people who are just very scared with what to eat. And I think that could be potentially a really big problem for generations to come.
Yeah, I think about when I was dealing with orthorexia, and it was during a time where I was prepping for a pageant, and I got my bachelor's in exercise physiology, my minor's in nutrition, and I had wanted to become a dietitian at one point, I thought. And so I started doing some health coaching right out of college for a company, and I was basically, you know, really getting pigeonholed into believing that these single ingredients were my problem. They were the issue of why I wasn't achieving the very specific thing in my physique that I needed to do to win swimsuit at a pageant or whatever it was. And so I became I tell people this all the time, that, you know, the reason I probably didn't end up on like the wellness to alt-right pipeline is because I have liberal hippie parents, and like they probably did a lot of, you know, good work in being like, what's happening here? So I think about that all the time, where I was so focused on clean foods, quote unquote, and making sure things were, quote, non-toxic. And it just was such a bizarre time of like having to constantly be thinking, okay, what's my next meal and how is it going to, I mean, it's all consuming.
Yeah.
You know, you're constantly thinking about what are the ingredients in the next thing I'm going to be consuming and taking in. So I can't imagine the amount of like time, effort, and energy that I have a lot of like empathy, I think, for these Maha moms, because the time and energy that it must take to think about those things for you and your child, and then to also be passing down that behavior, you know, because our children are going to look at us for how to act. And so to be passing down that behavior then to your children of like, oh, I have to read every label before I consume this product or consume this food. And so, yeah, I think about that all the time.
Yeah.
Well,
So
it's fascinating.
not even to mention though the generational implications of the loss of funding that we have, the loss of investment in science, the fear mongering around vaccines. I mean, the food side of it is huge and will have a lasting impact, but the greater picture of the dismantling of our health systems all the way around, I think should really be concerning to us all in the long run.
Yeah, definitely.
Yeah, I mean, they are very slow. I mean, this is what they're doing. They're relying on, and they're doing it with public support, because they have eroded trust in science and scientific expertise and regulatory agencies, and so that is allowing them to gut these federal agencies. And this is not a shocking thing. We knew this was going to happen. It was outlined in Project 2025. It's exactly what they wanted to do, was to gut these federal health agencies. And MAHA was a really good Trojan horse to do that. It was this idea that, you know, we're going to tap into something that everybody cares about, which is improving our food supply, making people helping people to get healthier. But we're going to kind of spin it so that we can now kind of gut all of this federal funding. And we're seeing that happen. We're seeing, you know, 20,000 HHS employees be fired. We're seeing career scientists leave their jobs because they're being censored. And I think it's going to have lasting effects. I talk to young stage scientists all the time, PhD students, early career investigators who are looking to go abroad, who are looking for areas that, you know, they are guaranteed funding, because right now a lot of their grants are on hold. And in a lot of research, you know, if you rely on continuous funding. So if you have a long-term study that's happening, you have to get continuous funding. You can't wait 6 months to get additional grant funding for a 6-month freeze that's going on, right? And so that it will disrupt all of your data sets. Like, let's say you have a 10-year data set, which happens all the time, right? For these longitudinal studies, it'll completely disrupt that data set. And so there's a lot of implications of that, and that's just kind of one implication, right? And it's not just the scientists that are going to be affected, right? It's the science, it's the long-term science, and it's the trust in expertise, and they rely on that erosion of trust and expertise because then they can step in and be the people who are going to solve things. And the irony is, and it's not even irony because it's the exact propaganda playbook, is that they are actually going to be bringing information that we can't trust. But then it becomes this both sidesism, and it's which one, who do we trust? You guys are like, it's both of you are like saying different things, like who can we trust, when really one side has an immense amount of evidence behind it and the other side doesn't. And so it's not an equal playing field, but propaganda really relies on this idea that it is an even playing field. And so it's like both sides just have differing opinions. And I think that's really important to point out and spot. And it's something I try to do in my content, is help people kind of identify that when that information is being used to kind of manipulate the narrative.
Yeah, you just kind of touched on this, but how could someone help a friend who has maybe fallen prey to this Maha propaganda or misinformation? I mean, I know I have tons of like former acquaintances or former friends who were not really friends anymore because they're Trump supporters, but there's a huge subset of people I'm thinking of right now in Eastern Iowa, really small towns in Eastern Iowa, who are all aboard the Maha train and now are anti-vax because of it and all of this. And so I'm curious how someone could maybe even begin that conversation, or how you might suggest someone do that.
So I think in real life, because I'm usually online, right? In real life, I think asking questions can sometimes help. So I think understanding like where people are concerned, why they're concerned, and that can give you a good starting place to kind of talk about things. So, for example, if people are concerned about dyes, so then they'll tell you like, oh, but these dyes are banned in Europe. And I realize that everyone's not going to have this like knowledge base of like to combat all of these talking points in real time, right? But you could start to, now that you've heard this, you can be like, well, they're not actually banned in other countries. Like other countries allow these dyes. And often corporations are just including them because that's what people are purchasing, right? And so if people purchase something different, they would. So I think that can be a good starting point, because I think a shared like understanding, kind of showing like, well, I also am concerned about our food environment. That's what I've found success with, like, because I come from kind of my PhD, the title of it is physical activity, nutrition, and wellness. So I like literally have a PhD in wellness. So anyway, I come from like this wellness world. Like I often say, like, if social media was around when I was like a teenager or even in my early 20s, like I might have been one of these like wellness influencers, right? Because I was very in that world, much like yourself, Maggie. And so I was thinking, like how much that kind of helps me, because I understand where these like Maha moms, quote unquote, are coming from. And so I try to never like go after them, or like I never disparage them, right? Because I get it. It's like I understand how you can get swept in just wanting like the best for yourself and your kids. So I think coming from a place of understanding, and then kind of just like talking through what the reality is. A big thing for me is like, there's this like conspiracy kind of idea. So like a conspiracy at the FDA, and also I should say acknowledging like where there are truths, because that's the thing, that's why this is so successful, is that they do rely on a little bit of truth. We do have issues in science, for example. Like we have a replication issue where a lot of scientific research is published and it can't be replicated. And that's really important in the scientific process. You have to publish your work, and then it needs to be replicated multiple times in order for us to have some idea of like, oh, this is actually probably accurate, right? Or this is like leading to an accurate kind of idea. And so that's an issue, and it's because of the way that we publish in science, which is this kind of like publish or perish thing, where if you're not publishing enough, you can like lose your job in academia. Instead of like publishing really good work, that can lead to kind of not as great of work being published. So those issues are talked about readily in the scientific universe, right? Like we talk about them, we try to figure out like, How do we avoid conflicts of interest? Okay, you have to disclose all of these things, where your funding sources are from. You have to recuse yourself if you have some sort of potential funding interest, right? But they take those narratives and then they make it seem like the entire process is untrustworthy, right? And you can't trust anything. And that's just not the case. And so I think that it's incumbent upon us as science communicators to acknowledge kind of some of these issues and then talk about them in a nuanced way. A really good example is the FDA. I've heard people say that like, oh, the FDA is bought and paid for by pharma. And so pharma is funding like half of the FDA. So the agency that's supposed to regulate the pharmaceutical industry is actually being funded by the pharmaceutical industry. And again, there's some truth to that. 48% of the FDA's funding last year, I believe, came from the pharmaceutical industry. So if you hear that, you are like, and you don't understand the nuance there, it's really easy to be like, oh my gosh, these guys are like in bed with each other and we can't trust anything that's going on. But then you have to introduce the nuance, right? And so the nuance is that funding is not just like payments. That funding, or it's not incentive payments, right? It's just fees. It's fees in order to, which is basically like done in any regulated industry. If you look at like the airline industry, so a pharmaceutical industry will pay the FDA a fee to basically go through the approval process. It's the exact same fee for whatever it is, and the FDA has not allowed those approvals, and they have allowed those approvals. But the reason that it exists is because the FDA wasn't adequately funded in the 90s. In 1992, it wasn't adequately funded, and so pharmaceutical industries were having to wait a really long time to get these approvals done. And so what they decided was, instead of Congress appropriating more funds to the FDA in order to hire more people to do these approvals, which would come from taxpayer dollars, by the way, they decided, okay, we're going to shift the burden to pharmaceutical companies. They need to pay the fee in order to hire the staff to go through these approvals. And so that's why that money comes into the FDA. And so the pharmaceutical companies are paying essentially to have these approvals done. That doesn't mean that that payment is in any way incentivizing these scientists who are going through these approvals, right? Because they're getting paid. Mm-hmm. These are just like
it's above board.
They're just user fees. They're user fees like any industry is doing. But see how that's a lot harder. I just took 3 minutes to explain that. And it's a lot easier to just tell you that half the funding comes from the FDA and that's corrupt. And so I think it's really important just to kind of like assess some of these claims. When you're seeing information on social media, I know this is not in person, but on social media, look for inflammatory language. I always use the example, and I've stitched videos before, of a woman, she started the video saying, "Are you poisoning your kids?" Like that kind of question is meant to elicit like a strong emotion, right? And anything that's really meant to elicit strong emotion usually is bullshit, right? Most people who are talking who are like have integrity and are evidence-based, they're going to talk in a nuanced way, and they're going to put things in context. They're going to talk about these additives, and they're going to talk about the research and what the dose looks like, because that is what never gets discussed, is the dose in these examples, right? The dose makes the poison. It's the basic foundation of toxicology. And if you're talking about a single ingredient and saying that it's toxic with no mention of dose, it's nonsensical. That doesn't make sense in science, right? Salt, sodium can be toxic at high doses, but in normal doses that we need it in, it's not toxic at all. Water can be toxic.
Water.
Oxygen.
Yeah, you can drown yourself.
Correct, and it has. If you look at, if there were like an insert for water, it would have drowning on it, right? Like water can be very harmful. But obviously, I'm drinking water right now. It's not harmful. We need it also to survive. So I think that just gets lost. And so kind of like looking for those sensationalized claims can be a good way to spot somebody who's spreading kind of misinformation and propaganda.
I mentioned this to Mallory last week, but I got blocked a couple of weeks ago by a very well-known influencer in the wellness space who does a lot of like the Costco videos where she shows up at Costco and, is like, "This is poison." Yeah. And I'm like, honestly, it's one of my prouder moments getting blocked by her, but what can I say?
I get preemptively blocked all the time. People send me videos and I'm like, I can't see this. I don't know who this is coming from.
Right. You have no idea who it even is. That's so funny. Well, Jessica, we are so grateful for your expertise and your time, and hope that the people listening and watching took away something. I know I certainly took away a lot today, and I feel like Maggie and I are very plugged into this space, so I know that folks listening learned something, and we appreciate you giving up that expertise.
Yeah, thank you so much for having me on.